here we are, very fortunate to have LexMedia Chobani, who is the Assistant Director of Minuteman Senior Services, with us today. And she's going to be talking about the services that Minuteman provides for both caregivers and individuals as they age with disabilities. And then we have Maura Donahue, who is the Community Living Advocacy Program Director from Boston Center for Independent Living, which is the independent living center that stretches way in a very large catchment area, Boston and Metro Boston, and provides supports for individuals with disabilities, and she'll tell you more about it. So I'll turn it over to our speakers. Thank you so much for coming today.
I'm LexMedia Chobani, Assistant Director at Minuteman Senior Services. I have been with Minuteman about 8 years, but in the network at a sister agency for another 9, so I've been in the network for quite some time. What I hope you come away with is an understanding of how you can access services for anyone in your family, and not to just think of, DDS, but to really think about how we can all support you. We don't want to duplicate services, but we certainly want to augment services in your particular situation, right? And so our tagline is know us before you need us, so I absolutely commend you all for coming out and taking the time to learn about this. We're always there for you in crisis, but it's just so much easier on yourselves and your family that you start learning about these things before you really are in that, crisis state. So, one thing that I try to illustrate visually is to think of your family as sort of like a, like a structure that you're building. And you see the horizontal block there that says growing to-do list. You have all the things on top that keep growing as you're, in a chronic caregiving state. As you're having, chronic conditions that you yourself may be, trying to stay strong and as independent as possible, those things continue to grow. But you're in a much stronger position. Any structures are much stronger than having one person, the person with the chronic condition or with the family caregiver, if you can start adding different supports underneath you. And especially with chronic caregiving, because it's very different than sort of a short-term stint. Like if you just had a knee replacement or something, you kind of go back to what that is, right? But chronic caregiving, this is something that you're working to make yourself as strong as possible, to make your family as strong as possible. So I want to kind of orient you to the aging network. The Aging Service Access Points, the ASAPs, were kind of a unique system in Massachusetts. It really started back in the 1970s as a grassroots movement. And just regular people wanted something different than going into a nursing home or trying to kind of struggle at home. And so legislators listened. And they created the Aging Service Access Point. It's under the Executive Office of Elder Affairs at the state level. And we have all the same core services. And this is how we have all the same core services. The state funds come through. We administer those programs by the guidelines and eligibility criteria set up by the state. So if you're, whatever town you're in, whether you're in the Cape or North Shore, Berkshires, Metro Boston, you all have access to the same core services. We also are an area agency on aging, and that is the way that the federal tax monies come into the state. And so there's about 670 across the country. And so one of the things that we are charged with doing as an area agency on aging is to do a community needs assessment about every 4 years. And so we elicit information from people, regular folks just out in the community, and asking them what their priorities are. What are their needs? What are their priorities? Then we take all that information back and we put it into an area plan. And then we put out grant opportunities for organizations to propose services that would meet those high priority needs. So it's local people deciding what their needs are, and then for us to then offer the grant and monitor the grant and give those monies out to those organizations that will then fulfill those services. We're also part of the Metro Boston Aging and Disability Resource Consortia. And this is supposedly a no wrong door effort. There's 11 across the state, and what that really is trying to do is to get aging services and the disability services working together so we know about each other. So if we get someone who we can help but may also benefit from the independent living center services, we refer to them, and vice versa. So again, we don't want to duplicate, but we want to make sure that you are aware of the full gamut of services so you can figure out what works best for you and your family. So now I'll get back to Minuteman. So Minuteman Senior Services is the aging service access point. We cover Minuteman and a number of towns surrounding us, 16 towns. Our vision is for people of all ages and disabilities will have the supports necessary to live with meaning, choice, and dignity. And our mission is to help seniors and people with disabilities live in the setting of their choice by engaging community resources and supporting caregivers. Our core values, we work from a place of being collaborative, innovative, accountable, responsive, compassionate, and inclusive. We have put these into I statements so that every employee can find their way to bringing this forward in the work that they do. I'm not going to read all that, but you can kind of see that. Looking for new ways of doing things, honoring commitments, doing the best to help people reach their goals. We're very person-centered in that way. Seeking to understand a person's needs without judgment, and bringing awareness to my assumptions and biases and actively working on challenging them. So our bias is not getting in the way of what your goal is. Our service area covers all the way out from Harvard, Boxborough, Stowe, through Concord, Lincoln, Lexington, all the way out to Wilmington, Woburn, and Arlington. In a different agency, but like I said, these services are all pretty much the same. And certainly the criteria, but I can help you with
Which
that.
is ASAP?
So,
H-span.
yeah, H-span is, everyone's changing their name.
Yeah.
It used to be, yeah, Elder Services of the Merrimack Valley. But now it's H-span, so I try to say both because some people only know it from that.
I know
Because they
all
still
the
have an
name
office in
changes.
Lawrence.
Exactly.
They still have the offices.
Oh yeah, the
in
office
Lawrence
is still
and
there.
Danvers, but they
I'm
merge.
sorry, I just said that because the ride doesn't come to Billerica
Exactly.
either.
It stops at the borders.
It's like,
Yeah, I know.
That's another.
It
other
should be a statewide, not a regional thing. I agree. And so with our catchment area, we have towns that are more rural, like Harvard, sort of suburban, like Bedford, Lexington, and then more urban, like Arlington, Woburn. So everybody has a little bit of a different need depending on your setting. And for Minuteman, we have about 60,000 plus folks who are over the age of 60. We're a nonprofit organization. We have a unique board structure that again is designed by the state. We have 25 board members. Everybody lives in our catchment area. And then more than half of the members have to be folks over 60, and half have to be representative of our local Council on Aging centers. So like Lexington, their community center, their director has a representative on our board. So again, the state wants local people to be directing and overseeing the mission, the vision, the way that funds are spent, that kind of thing. Our budget's about 28 million, but 19 of that go directly out to our vendors to support the individuals' service plans. And then we have about 25 plus programs and services, about 130 or more employees. And then, as you can see, we have an enormous volunteer base that really helps us to deliver services, because the funding is not sufficient enough for us to have, that many employees. And we're very grateful for all of them, honestly. We have about 75 different vendors in our contracts that will help to provide those in-home services. And then, we approximately served about 20,000 people in multiple programs over the past years. This is something I bring your attention to. It's called Social Determinants of Health. And this really helps solidify for me how our organization really does impact people's health and well-being. So they say, what determines health, right? So you got 20% is genetics, 20% is healthcare, but 60% is your social, environmental, lifestyle, kind of behavioral factors. And that's where you see Minuteman services. We provide housing resources, transportation resources, and then our nutrition program, we have home delivered meals, a registered dietitian. We will help you with application supports to get additional food benefits. So in that way, we really are supporting people's health. This will get us into a lot of the specific services that we provide. So I always start with information and referral, because if you want to take an action step, this is the next one. After coming and learning about sort of the agency overview, if you call information and referral, there's no cost to you. They are very good at listening to your situation, what's your need, your priority. And they will then ask you questions to help best match you with the resource or the service that will fit the needs that you're talking to them about, okay? And in this way, I'm not going to tell you all of the eligibility criteria for all of these programs, because even for us, that gets a bit tough to keep up with, but I don't want to overwhelm you with that. So the information referral line, it's also our matched options line. You call that, they will get you to us, and the information referral specialist will help you, okay? So you can also just ask them information that you'd like research on. We do not have any kickbacks. We provide unbiased information on services, resources. So if you say want to have possibly an elder law attorney, we will get you a list of different elder law attorneys in the area, all different kinds of things. So we don't have to provide that service, but we can help you find those folks. It's a good first place to start. The in-home services, so we have multiple programs that provide in-home services. Care management, we have that through multiple programs, so it's our state home care program. And a lot of people know us for that. We have senior care options with Tufts and United Healthcare. You have to have Medicare and Medicaid for that, but that's something where we provide the care management function for and collaborate with those insurance plans. Then we have our by your side private pay care management service. So that's a service for 18 years of age and older. So with those three programs, we really can help folks with care management. In our state home care program, we do have a nursing component. Our nurses will provide the clinical assessment for, say you need a bath or a home health aide or something like that. They will then go out and do the clinical assessment in your home, followed by the care manager, and they will support those assessments several times a year to just make sure that, you know, they're on top of any needs that change. Our vendor services, like I said, we have more than about 70 plus vendors who provide all kinds of different services, and I have a slide that will kind of give you a list of the different types of things we do. Protective services, we will investigate reports of possible abuse, whether it's financial, physical, emotional, sexual, or say an individual's self-neglect, or say a caregiver's neglect. And really what usually that's about is folks are overwhelmed and we just need to connect them to services or get them to a safe situation. And we always start with the least restrictive model and work with that person. So it's not coming in like the police or anything like that. It's just trying to go in and understand what's going on and then help you address whatever those needs are. Our caregiver support program. So this is through the state Massachusetts Family Caregiver Support Program. This is a short-term intervention, but it's open pretty much to anyone 18 years of age and older. And so it's for folks who, anybody who's caring for somebody who is aging with chronic health needs. They will listen to you, and I think sometimes it's the caregiver who is always asked about the person that they're caring for, but not asked necessarily about your own needs. So this program focuses on the family member. They want to hear what's going on for you, how we can support you, what are your priorities, what are your needs so that you stay strong and healthy. Then they will go back and do some research. They'll come back with an action plan and resources and then work with you on understanding that. They won't really implement the plan, but they can get you that far. Okay, and that is, and sometimes, you know, it's just having somebody listen and validate what you're going through can be really huge. We do have services that they can connect you to, whether it's support groups or things like that, and we have some funds that we can help with a particular need if it's short-term based. So that's something I plant out there. We have some things online that I recommend you think about, because that might be a program that could really help you at whatever stage you're at. Options counseling, this is again another short-term program. It really came about as a way to help people get out of nursing homes and back into the community. So they kind of started focusing on housing resources for folks who are 18 years of age and older. It's kind of grown a bit broader than that, and so they kind of start there, but if you have other needs, and again it's person-centered, so whatever your goal is, that you have someone, again no charge, they will work with you to figure out what resources are available, come back with those options, present those to you, and help you get started with application support and the like. So that's another program that if you're the individual who's looking to work through options to reach your goals, that's something that's available to you, and that's somebody, anybody 18 years of age and older, we can help and support. Our Meals on Wheels program, we have drivers that will deliver nutritious meals that are designed by the registered dietitian we have on site, and they do a great job of bringing a hot meal Monday through Friday, so every day they're out there. Our money management program really helps folks pay their bills. You'll have somebody come out once a month and make sure that your bills are paid. It's usually with Social Security monies that they're working with, but it's such a great way to stabilize someone, because maybe it's something where maybe you never were the one to pay the bills. Maybe you have some vision impairment. Maybe you have some arthritis or something that doesn't allow you to sign checks. There's multiple reasons why you might not be able to pay your bills. But this way, your rent is paid or your mortgage is paid, your insurance is paid, your medication, you know, all those things, your food, all those things are paid, and they'll help you with the budget if you want. They're also a great set of eyes on making sure that, you know, there's no fraud going on. So many times, you know, folks who are vulnerable in that way are targets of scams. And so they're also a set of eyes on that as well. But they come out monthly, and we have a lot of folks who are in that program for, say, 5 to 10 years. So helping somebody stay in the community just by being able to make sure that your bills and things are paid. And there's no cost for that program. Supportive housing is a model, it's a national model, where the Housing Authority collaborates with the Aging Service Access Point like Minuteman. We provide a care manager who's on site at the Housing Authority, and in this case we have a contract with Drake Village in Arlington, and so our care manager, they call them a resident services coordinator, is on site, does all the care management, assessment of need, coordination of services for those folks enrolled in some of Minuteman's programs, but is also there as a resource for everybody who lives in that building, as well as helping with recreational activities and dining meals. So they really get to know you, and you know, it's a wonderful way of building that support right in the housing site. Our community-based services, just like here at Lexington, we have senior dining. So we provide the staff, the food, and the Lexington Community Center provides this wonderful space and invites people in. And so if you're able to socialize, this is a great place to get out and have a meal with someone, and they usually do some kind of entertainment or educational component. Our SHINE program is unbiased information on Medicare beneficiary plans. So you'll meet with someone, open enrollment is going on right now, I think for another week. So if you need help figuring out what's your best plan for Medicare, I highly recommend them. Again, they're volunteers, but they have to go through like 50 hours of training. They have to take an exam on Medicare benefits to show that they know what they're talking about. And then they will sit with you, listen to what your needs are, and then help you figure out what your options are. And it's very helpful because there's a litany of plans that are available that cover medication or whatever. So again, that's something that you can utilize. Legal services, Greater Boston Legal Services is one of the grants that we monitor through our Area Agency on Aging hat. And that really is to provide free legal services to seniors. A lot of times it's about eviction, stopping eviction. So many folks in Massachusetts are having a hard time just making ends meet. And so if something happens and you can't continue that, you can get yourself behind. So they will help you with that. Our healthy living programs. This is something, again, for folks who are 18 years of age and older. There's no cost. Anyone in the community can join. And this is a way to start learning about your chronic illness, and it's about anything. You go about once a week, maybe an hour and a half, 2 hours at a time. They're evidence-based classes, so they've done the research to put the materials together nationally, and if you go through the program, you will have action plans every week, and so you're learning how to change your lifestyle, learning how to kind of take those things that are in your way, specific to you, and work on them with a group who's supportive, and also holding each other accountable, trying to encourage each other to make those changes and to learn about what it is. So they have them on diabetes, they have them on chronic disease, they have them on pain. They also have them for family caregivers. One's called the Powerful Tools for Caregivers, and one is the Savvy Caregiver, which is specifically for folks who are caring for somebody with Alzheimer's. But again, there's no cost to the participant, and you kind of start building some community with folks who are going through similar things, who are in that action-oriented mode to really try to make a difference with their own lives or with the people around them. Then, as I said, we have some education and support groups that we collaborate with. Lexington is one where we do some support groups together. And then the nursing home-based programs are, first we have our nurses, who I was talking about in the other program that does a clinical assessment. They also go to nursing homes to screen for mass health through the clinical benefit. And so they will see if someone is clinically eligible for mass health and do those screenings. We have our nursing home ombudsman program that really is an advocate for residents of skilled nursing facilities. They don't work for the skilled nursing facility, and most of them are volunteers. Again, they go through a significant training for that, but they go weekly to the nursing homes, do visits around through the nursing homes, and really help any resident who has an issue, a concern, a complaint, work through that with the administration prior to taking that to the state. And that program, again, is run by our ombudsman program director at Minuteman. So any question, well, I guess we're taking questions at the end, so I won't do that. Yeah, sorry. I know usually there's a lot of questions around there, there's a lot of information. So I highlight a few programs, we talked some about these that are for 18 years of age and older. So the caregiver program, our options counseling program, those might really benefit you. Healthy living, again, might benefit you. And then we also are a member of Honoring Choices, which is, I think it's a state movement, really to help folks get their advanced care directives in place. And so that's like your health care proxy, your power of attorney. So we have the forms, we link to their website. We have the forms, so you can just download those. But the great thing that they have at Honoring Choices on the website is they have wonderful discussions. And they have them in multiple languages. Because that's what we found is the stumbling block a lot of times, is to have that really difficult conversation with the family. And also we want you to name whoever's the healthcare agent who you've named, who's going to help you if for some reason you're unconscious and not able to make those decisions for yourself. You need to give them the copy of the healthcare proxy and your physician so that those things are all in place. And I did this with my kids when they graduated high school at 18, because this again is something for 18 years of age and older, so that they have that in place. So it's for everybody to keep those updated, and so that we're all, someone is going by our wishes, not just kind of making it up. These are some of the services that are provided by our vendor network. There's a lot of them. I'm not going to talk about all of them, but these are the funds that we give out that provide the payment for the in-home services. So homemakers can do your cleaning, they can do your grocery shopping, personal care for bathing. We have a heavy chore that can go out and really do a thorough cleaning of someone's home. Alzheimer's Day programs, laundry services, the grocery shopping, like I said, medication dispensing equipment. You have those lifelines, those, I don't know if you've seen the ads for those, like a button, right? It's called the Personal Emergency Response System. We have contracts for those, transportation, and then also for respite. So sometimes people will need help. They might be ill themselves if they're the family caregiver for their loved one, if it's for a long time, or if you also are the one who needs the respite. So we can help with that. We also have language interpreters. So we provide professional free interpreter services for a multitude of languages, and have vendors that can help with on the phone service. We can connect with them like a minute, or in person. So that is something that is your right, and that is something that we provide. And so, as I say, it can be on the phone or in person, and it is your civil right. If your language is other than English as your primary language, that is your right. So the home delivered meal program, I do want to talk a little bit about this, because it's not just the meal itself. It does help with nutrition, obviously, but that driver is going out every day. So you see that person every day. And they provide sort of the eyes and ears on them, and it's really a safety check, right? So many of our drivers have found folks who have either been on the floor or who are having some kind of decline, and we contact the care manager, who then follows up immediately. If it's an emergency, obviously, we call 911 and the like. It's also socialization, right? You start seeing that same person over and over again, or a number of people who help with the meals. It's a lovely thing, right? And for folks who are receiving meals, there's no income eligibility, right? It's just that you are at home and that you really can't get out to get food, right? Or maybe you don't have someone to help make it, and you have some kind of a limitation where you can't prepare the meal. And so there's no cost. We ask for a donation, but there's no cost to you for this. And so think about that for yourselves, for family members, especially if you have hospitalization or something changes where you need some support. This can really help you. And it can be for a week, a month, a couple of months. It doesn't have to be long-term. It can be. We have a number of people who've been on having this support for a number of years, but it doesn't have to be. Okay. We received a National Innovation Award because what we've done is to try to leverage all of that good information from the drivers, their observations, to put it in an app so that once they go deliver the meal, they're looking for clear signs of any kind of change of condition. So that goes right to the care manager, and then they follow up. And so that's what we've kind of been doing. As I said, our care management service for all. So I think about this for you all, because say we've had situations where you've been maybe caring for someone in your family for a while, maybe that adult with some kind of a disability, and now maybe it's your spouse or yourself who has a hospitalization. So don't just think about DDS. Think about that you might be, or your spouse might be, eligible for services to get some support in the home, right? And you might then have a care manager, right, who can then have services to support you or your spouse, right? And we've certainly helped folks like that, and that's why I think it's fabulous that we have the opportunity to come out and talk to you about that, because we're all aging, we're all aging. I'm right up there with everybody aging too. And so it's important to know and to give permission for you to get help for you or for your spouse. And that we've helped folks, where a lot of times too, your spouse may be that person who you've always talked through everything with, and now they might need the help, and now you feel like it's all on you. You don't have that as much. Reach out to the Family Caregiver Program, right? Reach out to Minuteman. Reach out to see if we can get a care manager in there to help you. Families always try, individuals try very hard to rise, to do everything themselves, but that's a time to look to see what other supports you can put under your, family structure, right? We don't want you to get so depleted and then call, right? We'll always help you, but that's a time when you see a change like that in your family, call. Say what's going on, and let's see if there are some things that we can do to support you, okay? So the care manager, they go out to your home, they'll do a home assessment, right, in your home, a needs assessment. They will then look at what kind of services you would be eligible for. They'll put together a service plan with you, again, to help you meet your goals. And then they'll coordinate those services. And it's a long-term relationship, as long as you want it, or for as short as you want it, right? There are, again, supports for the family caregiver. So those are available to you. And the other thing that a care manager really helps you do is just navigate this very complex world of services, right? They keep their knowledge up to speed so they know what is available, right? And they'll work with you on these things. The one thing that I will say, because of the pandemic, this is across the continuum of healthcare. We're in a serious workforce shortage. You'll see it at the hospitals, the skilled nursing facilities, the visiting nurses, the certified nursing, services. You certainly see it in home health in our area. So we are all struggling to find the workers who we used to have very readily, or at least more readily, to be able to fill the service plans. But that is something that we're all struggling with. So just to put that out there, anybody who's interested in home care, advocacy for that, we've been advocating at the legislature around this. We are really in a real difficulty, and it's not just our area, it's not just Massachusetts, it's across the country. And the pandemic really kind of exacerbated that because so many workers are exhausted, burnt out. A lot of them moved on to other roles. Some of them got very ill. And a lot of them had to be home for their kids when there was no school in session. So some of them have come back, but a lot of them have not. And we don't have the replacement of folks. So that is something that we're all really working through. Folks are being very creative, but just to put it out there, it's sort of a new reality that we're all having to address. And I'm sure DDS is in the same situation because we're all pull on a lot of the same people for fulfilling those roles. So, and our Minuteman By Your Side program, this is our private pay care management program, and we started this because some folks are not eligible for the state home care program where you can get a care manager. Sometimes it's by age. That program you have to be over 60. By Your Side you can be 18 plus, but it is private pay. There's no state or federal funding for it. So we have a licensed clinical social worker as our care manager, and we've helped folks. We had a gentleman who was in his 50s who had a cognitive impairment and needed help looking for housing in another area. And so we were able to go with him, look at housing options, figure out which one would help him the most, and then work with him on building that connection in the community so that he would have, a good quality of life. The thing that's different with By Your Side, besides the having to pay for it directly, is that we can see you weekly, monthly, we can help you at the hospital, in the ER. We can help you however you need us. And for a short time or a long time. Most folks need us for a few months. They kind of want the assessment, the plan, and get it stabilized, and then they can kind of take it on from there. Other people really want us involved. We ask for a 1 hour a month minimum because we want to be up to speed clinically on what's going on for you, because they know they're going to need us down the road if something changes, and they really want that support. So they find that helpful. But it totally depends. You can do it short term or long term, however you would like. But that way, Minutemen can offer everybody an opportunity to have a care manager. This is a local program though, so not every aging service access point will have this one, but they have all the other ones. And as I talked about the pandemic, it really has hurt us with the workforce shortage. We've really adapted service delivery to be able to make sure that we did deliver services. We continue to do that. It was really heartwarming to see people kind of volunteer, staff would volunteer to deliver meals on top of the stuff they were already doing, just to make sure we could get it out and get people things. But it's very difficult right now with the workforce. We have a commitment to quality. It usually started with compliance, but we're really pushing towards data-driven outcomes and helping to do continuous improvement that will help us towards population health. We're really looking at health equity to make sure that we are positively impacting health equity, and starting to look at our clinical value. Again, how social determinants of health are impacting health outcomes. And these are some things that you can do. One is to build that community care team, all those blocks underneath that structure, right? Information referral is a good place to start. Maybe you need an attorney, maybe you need a care manager, maybe you need somebody in Shine to help you with insurance. What would you do if you couldn't drive? How would you get your groceries? Maybe you need some services in the town to say, oh, what would I do? Which pharmacies deliver? What if you couldn't get your medications and go to the pharmacist? How would you get them? Start thinking through those things. Try them out. A lot of these things, you have to sign up. You have to, figure out how you would do that. Is there an electronic payment? What if you couldn't get to the bank? What would you do, right? So all those things is a learning curve. So just a little bit over time, pick one, start working it through. But build your community care team. I'm sure you already have folks who you look to for specific services. But if you learn about them, kind of get to know a couple, that will help you so you don't have to do that in the midst of a situation. Learning about the resources, your advanced care directives, always to keep those up to snuff. Learning about chronic conditions, maybe doing a home safety assessment. We do those with our By Your Side care management program. Maybe volunteer if you have extra time, which you may really not have extra time, but I know the group I'm talking to, but you never know. And then we have an e-newsletter. You can certainly subscribe to that so you kind of know what's going on. And then the state, just so you know, in your own circles, the state has now a free online home care aid training program to help people get certified for homemaking and things like that, to try to get those folks to these home health agencies to help with the workforce shortage. So that's something you can help, just socialize that and see if anyone in your circles would be, interested in that. But those are all things that you can do. And I thank you very much.
Thank you.
Thank you.
Do you want to do questions now or at the
I think
total
if
end?
people don't mind, we'll save questions until the end. Just take your notes and we'll save them to the end.
Okay. So I'm with Boston Center for Independent Living. So before I start, I just want to ask a couple questions. How many of you are involved with DDS at this point? How many of you know about the independent living centers? Okay. Oh, raise my voice, thank you. My husband actually uses hearing aids, so usually I'm too loud and people tell me I'm too loud. So I'm here today, we work together in the Metro Boston ADRC, which she explained a little bit is the Aging and Disability Resource Consortium. We also do options counseling, which is a free service. It's no wrong door. So it's funded by the Executive Office of Elder Affairs. I want to back up a little bit and tell you a little bit about independent living centers. We are a civil rights organization. We have also some core things that all across the country you will see every independent living center does. We're proud to say that we are the second independent living center in the country, which is why we're so big. So there are 10 different independent living centers in the area. We cover Boston and Metro Boston area, so we run the Boston ADRC, which just means that we have group meetings on a monthly basis where we talk about and share resources with the senior care agencies, City of Boston Services, which is the AAA in our area, as well as us as the Independent Living Center. So every Aging and Disability Resource Consortium has an independent living center component. So Metro Boston, ADRC is run by Minuteman, but they will also have somebody from the local IL center. So you can call any independent living center and get services for free. You can call yourself, your loved one can call. We're all about human rights, civil rights, system advocacy. So we do individual advocacy, but we're also there at the State House, members of Dignity Alliance and other groups. That's why Rosalie is familiar with our programs. If you've ever worked with the Federation for Special Needs, the Mass Office on Disability, Mass Rehab Commission, those are all agencies that we work with, as well as senior home care agencies. We will, options counseling is a short-term free service, as I said, to anyone who calls. I have had neighbors call us, questions about they're helping their person who lives next door. They don't know what to do. They've been providing meals. You know, they don't know about state home care services. They don't know that all of our agencies pretty much will help people with benefit, either figuring out what benefits they are eligible for or helping apply for benefits. Because we work with people with disabilities, 51% of the people at all independent living centers need to be someone with disability. So one of our core things is that we have disability peer advocates who work for us. Some are part-time, some are full-time. Lots of people go out on medical leave for various reasons. We hire interns, we'll take any volunteers for, you know, different components of our program. So what they do is peer mentoring. They may actually help somebody apply for services. You know, how do I get the ride? Some people need you to help them walk through it. Some people it's, you know, the one thing from COVID is that we do a lot of virtual stuff now. So we can do it in person, virtual, at a nursing home, in their home, in our office. We have an office in downtown Boston. We also have an office in Dorchester because we opened a satellite office primarily to do outreach to the Vietnamese and Hispanic communities. But we'll go anywhere within our catchment area. So I have the little cards out there that has the map of all the towns that we cover. So we go as far as Acton, Carlisle, Concord, and then down the South Shore to Sharon, Braintree. It's a big area. So there's 3 people on my team. So I'm on the Community Living Advocacy team, which used to be called Nursing Home Transition. So every independent living center does transition services. That's one of our core services. You may be working with someone who has a disability that's in the school system still, or is in that transition age. So independent living centers do go into the schools. We have groups that we do with young adults, and it's focused where they decide the plan, and you know, they're working with the IEP, but they're also working on what's the next step. Are they going to be with DDS as adults? Are they going to be with DMH? You know, some want to be out on their own. They don't want to live with their parents anymore, even though the parents are nervous about that. We will help work through some of that. So we do similar things to what you're doing here, where there may be some caregiver support programs. They're more of our focuses, like we'll go into Charlestown High School and have a group of young adults who are working through, maybe they want an internship, they want to volunteer, they want jobs. We help them apply to MRC. MRC now is online with their Connect. Some people are very savvy and can do that. We have other people that don't use a computer, don't know how to use a computer. Often it's the parents, like myself, who are asking the younger people, how do we do this? You know, and they're more savvy about looking something up online. We have all learned about Zoom, and we're all pretty good at Zoom. We do team meetings, you know, and I think, again, we're learning some of that from the young adults that we serve. So as far as when we talk about no wrong door, one thing I mentioned as I came in here is that has been the philosophy since I started in human services 36 years ago when I worked at Mr. Valley Elder Services. The reality is there still is a misunderstanding about disability community. So what we run into a lot, and we're trying to break down those barriers with our ADRC, is that even at the state level, options counseling is funded by the Executive Office of Elder Affairs. So we give them information. I will put in information that I went to this outreach event, how many people came, blah, blah, blah. They take their data, figure it out. But they often will say, anybody over 60, we call Minuteman, or we call Central Boston Elder Services. And then they think we just work with people under 60. So I'm here to tell you we work with all ages. We have, you know, kids who are just born where somebody needs help. They don't know how to access the system. Our INR people are wonderful. They do a similar service where they tell you all the resources in the area. get an idea of what you're looking for. If you're just calling that one time, I just need 2 or 3 things, someone tells you a story and we give them a few resources. If it seems like it's gonna be a little bit more in-depth, yes, we do the nursing homes for options counseling, but we really will do any kind of short-term counseling that someone needs. So some of that is venting, hearing what they are, trying to figure out, again, similar, what's the plan? What are you looking for? What does the person want? Because I will have people who call and tell me so-and-so wants this. We give them some resources. Turns out that person didn't want what that other person thought they wanted. So we're very big on independent living philosophy, similar to DDS. I was a human rights advocate trained through DDS. I worked for EMARC for 4 years in the adult foster care program. So I know what you do. We talk about guardianship. That used to be the route where everybody did that at age 18. Now we're looking towards limited guardianships or supported decision making. So we help people create their plan and work with them towards what would that mean for them, if that's something they want. We do access legal services. We encourage people to use the legal system if they need it. We have some disability advocates who will work with people, so we don't necessarily do legal services, but we work very closely with Greater Boston Legal Services and disability rights agencies. Sometimes people need to talk to a disability lawyer. They have some concerns or suing the school system, suing the healthcare system, whatever it is. We'll help them up that chain of command, but we're very clear that, we're caseworkers, we're short-term counselors. We can get you those resources, but we can't tell you, you should use this route. But if that's something people are interested in, that's certainly something that we do. We're up at the State House all the time because our office is down the street. So there's legislative initiatives. We work with the ARC on some of that. We work with DDS on some of that, MRC. As I mentioned, we're a member of Dignity Alliance in Massachusetts, which was created during COVID. And it was essentially to try to help people get out of nursing homes and get more community-based supports. As you probably know, historically, that's been the case with, get people out of Fernald, get people out of institutions back into the community. It works when there's community support. So there's agencies like hers and mine that will do some of that, but the reality is, if you need a PCA, as she said, you're gonna be waiting, but do you know that process? So we do have a PCA component to our program, but we don't give out just our program information. We talk with people about what their needs are. There may be another PCA agency they're more familiar with. Northeast South runs one. They have a great program. We have no problem sharing information, but the bottom line is if somebody doesn't actually have their own personal care attendant, like a family member, someone that will be paid, they will be on a waiting list or, using the directory. So there's a PCA directory, much like what she showed you, that we can help people. When we do that assessment, we talk to them about how to access that. Some people can direct their own services, that is the goal. But if they can't, Mass Rehab Commission does have other people, if there aren't family members or support people who want to manage the PCA program. So that's something that we also talk about. So we do some service coordination for people. We do have a program where we work with long-term services and supports through like One Care. Will send us some information. Is primarily for casework, maybe housing search, specialty things, getting equipment, things like that. So we also are an agency that works on home modifications. So my program really is getting people out of nursing homes, getting people out of shelters, getting them into the community. As you know, there's not a great availability of affordable and accessible housing. So if you have somebody who uses a wheelchair or has some mobility device, they're going to be waiting longer. There may be a lottery for brand new housing happening in Newton. There may only be 2 units that are wheelchair accessible. And that's something we run into all the time. So again, you may want someone in your family to live in your same town, but it may be that they have to broaden the area or they're going to wait 4 or 5 years. In the Greater Boston area, some of the waiting lists are 3 to 5 years. Even people who are in nursing homes and facilities, they get priority just like someone who's homeless gets priority. It's still a good 5-6 year wait. So it's something, if you're thinking about it or you have a young adult who's thinking about it, you should plan sooner than later. Coming from EMARC, which is now called Communitas, we would often try to get families, we were doing adult foster care, to start thinking about how are you going to access DDS services. A lot of people only hear from their coordinator during transition and then only when there's a crisis. And that's because their caseloads are high, and that's how the state has managed it for years. but you need to be that squeaky wheel if you want to get services. So we will sometimes advocate with people, go to meetings with them, do a virtual meeting with them, that we don't necessarily need to be at that meeting. We can give them a way to strategize and kind of work on what they want to say and how they want to present that information. All of the IL centers do that. So that's one other piece. So we changed our name to Community Living Advocacy to kind of broaden what we do. Other IL centers would call it nursing home transition, but every independent living center does transition services. So you can call, our entryway is similar to senior home care, that you would call our INR people. They make a determination if it's a short-term INR, and sometimes short-term INR does turn into a month or two of, follow up, are these the right resources, do you need something else, are you calling back, and that's okay. It's really up to you about what you want. Some people transition to options counseling. We get a lot of options counseling in my program because there's the assumption if someone's in the nursing home that they need that assistance with us to get out. So primarily we work to get people out of the facilities, but we're obviously, if somebody's comfortable and they want to stay, we've had people who want to be in assisted living for that support for the social network or whatever. We're not going to say, oh no, you should leave. We need to honor what that person wants, but we'll try to support them through. Maybe they do need the long-term care ombudsman to help them with any violation of their rights. I was an ombudsman in South Carolina for a few years, so I know the system. Minuteman also has an assisted living ombudsman. So there are people that are living in assisted living facilities that also have ombudsmen to help them with their rights. Their regulations are a little different because assisted living is run by Executive Office of Elder Affairs, where nursing homes, it's Department of Public Health. So we work with all those different programs. Sometimes we're just giving you the referral, like call this person, that's your assisted living ombudsman. Julie will know the answers to those things. So again, those are the kind of referrals that we make for everybody. Whether it's PCA services, options counseling, whatever it is that you might need, you can call us and we can figure it out. If we don't do it, we're certainly giving you a couple resources that might do that. Sometimes it is coming back to your city or town. Like towns of Lexington, most towns do have some social service component. They may call it different things, but most of the towns, they're pretty great. You might have somebody who comes to that meal site and meets with people, counsels on aging. You might have somebody who goes to some of the day programs. A lot of day programs, people didn't come back after COVID, or they're on waiting lists because it's difficult to get staff. But those are resources that you can use as well. So we're here, just to try to let you know what kind of support is out there. But options counseling for anyone. It can be, like I said, a neighbor, a friend, a parent, person themselves. We love to talk to someone about their own issues, but sometimes it turns into the whole family. We have several people that we will have disability peer advocates working with one person, the sister's working with someone else. We recently were involved in a situation with an assisted living in Boston that was closing. They were only required to give 90 days notice. That's a little scary for people. There's been 5 or 6 assisted livings that have closed in this past year. Sometimes it needs to happen. There are open beds at other places if someone really, truly wants and needs that level of care. It may not be in the community that you want. We do some advocacy around that. We were able to get the Executive Office of Elder Affairs to extend that so that now assisted livings, they have to give you 4 months notice. We would love it to be 6 months or a year, just like tenant services, but still working on the advocacy piece. But we were able to get people to be able to stay until they actually had some appropriate places. We went in, did options counseling, presented information, telling people you don't have to go to nursing homes. We still had some people who went to nursing homes, and then we'll work with them to help them get back to the community if that's safe and appropriate and what they want. And again, it's everybody's right to do what they want. It's difficult sometimes as parents and caregivers to think about that. As someone who worked in AFC, I can tell you the majority of the people with our agency were people that worked with EMAC. They knew us from the REC program or some other programs that we did, family support programs. It was a struggle for people to think about, my person is now 18 or 19 and can make their own decision. It's very hard to let go. I have a cousin who's 63. He lives in a group home in Tewksbury. When he went into his group home at the age of 30, everyone in the family panicked. Everybody was judging my aunt. How could she do that? Why wouldn't she take care of him? As they aged, they were thankful that he was in the same town. They could visit him. But he certainly decided sometimes he didn't want to come to family events. That's what independent living is all about. We want people to be able to live their full life and choose what they want to do. So that's a core piece of what all the independent living centers do. And I'm sure that that's a lot of what you all struggle with. So we can even just walk somebody through that, like how you're feeling about it and how do you want to present this to your loved one. Can also help that other person come through. We've had people who say, I don't care that I'm unhoused, this is my issue. And we were thinking they were calling us about housing. They didn't want the housing support, they wanted something else. Eventually they might want housing support. We have people come and go from us, we have people who stay with us for years. So we have a lot of disability peer advocates. My program, it's myself and 2 advocates who go out primarily to the nursing homes and meet people in person, and then we do the options counseling over the phone. So the state offers options counseling program, which is about 18 hours, I think. Don't quote me on the number of hours, but that all of their options counselors go through yearly and then have some quarterly meetings to kind of share resources. As I said, the Boston ADRC, we meet monthly, the Metro Boston, not as often, but we check in with each other. We had COVID grants where we were passing out information for people, vaccination sites, those kind of things. Sometimes you don't know what's out there. You know, we help people access the RAFT program so that they're not being evicted. They can get, you know, we help them, support them through that application to get funding if they're in threat of losing their housing. Trying to help work through that, and it doesn't always have to be legal. Sometimes it is just financial, getting the furniture, getting some of those things up and running. I guess the only other piece I would say is, you know, similar, that we do all the benefits counseling. We will do it in person. We also have, you know, like we recently had a grant where we were able to help people get telephones and assistive devices. If we don't have the funding for that, we go to Mass Rehab Commission. So we do have an application process for something called 7B funds. So if you tried in your community to get a laptop, you don't have the funding to do that. It's sort of a funding of last resort, but it's funding from the state. So we can help people access that for home modifications, for ancillary things like hearing aids. Some insurances don't cover hearing aids. Maybe they're not on Mass Health and they can't get that. If, you know, maybe there's a local church or Lions Club that helps with that. But if they've tried other resources and can't get that, there is funding through independent living centers and Mass Rehab to get those things. So Mass Rehab is a great resource. People only think about them as far as vocational. And I will have a lot of people say, I don't need a job, I don't want a job, I'm on disability, I can't do that. Mass Rehab has a home care program, similar to what they have for seniors. A lot of people don't know about it. It's not widely publicized lately because, again, there's waiting lists. So people will get on that list, might qualify for someone to come into the home and help with cleaning, but they don't have that person, so you're on a waiting list. But we always tell people just get on the waiting list, just like housing. You never know when you're gonna get off that list or when you're gonna get called. We used to have kids at 18 to apply for Section 8 because it takes 7 or 8 years to get that Section 8. Massachusetts, we have other housing programs. We've sort of become housing specialists at the independent living centers, and I'm sure they have too. Because of the housing crunch, that's a lot of what we do. We have a housing workshop twice a month. People can come in person, they can do it over Zoom. It tells people a lot about some of these different voucher programs, things they can apply to. Doesn't necessarily help a lot for people with higher income, but you wouldn't believe what affordability is. If you're in Lexington and they're building something, you may qualify and you don't even realize it, because when they're looking at the cost of living and what it costs to be somewhere. So we tell people, look at, you know, Massachusetts launched this new Housing Navigator program. We use it all the time. We tell people to look at it whenever there's a lottery, apply. You never know. So we had somebody who was waiting for services through DDS and wasn't able to get services. And I will say, this is a Mass Health program. You may have heard about waivers. If you've heard about it, we help people get waivers. So what happens is it's a diversion program through Mass Health. If somebody's living in a facility or a hospital or anything beyond 90 days, they can apply for a waiver. So there's 4 different waivers. 2 of them are ABI waivers for someone who had acquired brain injury, stroke, something along those lines. And those are for community living or residential. And then there are 2 called MFP. You might have heard about that in the past. They called it Money Follows the Person. They changed the name to Moving Forward Program. But there is, you know, incentive for people to get out of facilities. Mass Health is really driving that because they get federal funding to work on that program. Hopefully there's more money coming into that program. The reality is that any of the residential programs, if your person qualifies for that, meaning they need 24-hour care, they're in a nursing home or whatever, DDS monitors that. DDS is supposed to find the housing. It's tricky. DDS doesn't have enough housing, as you probably heard. They really will only place people, they don't like to say they have waiting lists, they will only place somebody sometimes if there's a crisis. They will ask sometimes agencies, you know, like EMARC has homes, TIL has homes, Northeast Arc has homes. They will ask them to create a home sometimes so that it will be a small home model, but we don't see a lot of homes for people that have acquired brain injury and don't have an intellectual disability, or you know, someone who's just purely physical disabilities but needs that 24-hour care. So I was working with someone who had been a whole year working with DDS that got the waiver, was not able to get, they tried group housing, they tried adult foster care, it wasn't coming together. He actually just got a lottery spot and is moving with the lottery into a home, you know, single room apartment, but his family's in the area. He's getting PCA services, it's all coming together. It was supposed to be December, they put it off till January, but the housing is working with us, which is great. But this guy's been in a nursing home for 2.5 years, and he's in his 50s. And he was really only there because there was no place to go. His family lived on a second floor. They were caregivers for a senior, so they weren't gonna move, and he couldn't access that with using a wheelchair. So that's one of our success stories, but it takes time. So for all of you, there needs to be some wraparound services. This guy had a family member who worked for DMH, but they're a caregiver for a senior in their home. So we can fully respect that. He didn't want to ask that person to do applications. So we help with applications. If somebody can't write, we'll figure that out. You know, we have advocates that know how to do some of this. We have advocates who are struggling to do it just as well. So we're all learning about the process together. I came from protective services, senior services. I worked for EMARC in the adult foster care program, as I said, ombudsman program. I've been doing this for 1.5 years and I'm still learning. So I will reach out, I will ask Minuteman, I will ask the ombudsman, try to figure out, so we're doing the same thing that you're doing, but sometimes we know more about that waiver program that you might not know how that process works. So we certainly appreciate everybody coming to learn. As we said today, she had said it's probably going to be a small group, but we know that it's going to be out there on the news, but you guys have friends and family, and sometimes what happens is you become your own caregiver group. You have friends who go to the same rec programs, social programs. They say, oh, I heard about this, how about that? So just spread the word. We'll talk to anybody.
Thank you.
Thank you.
We really appreciate the two of you coming, and I want to open it up to questions.